Consumption of 300 milligrams per day of full spectrum ashwagandha root for 60 days reported to be safely and effectively leading to improved resistance towards stress, improved self-reported quality of life, and reduced level of cortisol. So what ashwagandha basically does, it helps to have a healthier stress response. Let's talk about adrenal function. The adrenal, as a reminder, this is something that most of you already know. When we are under stress, the hypothalamus releases the corticotropin release hormone that stimulates the anterior lobe of the pituitary gland, which secretes the adrenocorticotropic hormone, and then that stimulates the adrenal cortex to release glucocorticoid, which is basically cortisol, is what we typically measure. And so there's a negative feedback when we have sufficient amount of cortisol. It shuts down the production with the anterior pituitary and the hypothalamus. And so every time we're stressed, that could be physical, like we got injured, we're in pain. It could also be psychological, that could be emotional. We produce cortisol, which reduces inflammation and pain. This is sort of how your patient's cortisol levels should look like throughout the day if you measure them. With some patients, unfortunately, over time, production of cortisol could reduce in the morning because of exhaustion. So cortisol impacts our blood pressure. Cortisol reduces serotonin. Remember, it's our stress hormone. It decreases sensitivity to pain. It suppresses the immune system. It increases blood sugar, right? So every time we got cortisol released, our liver starts the gluconeogenesis process to basically break down more sugar into our bloodstream and then heighten our attention. So cortisol is a stress hormone. And when we're under a fight or flight, somebody is attacking us, or we're in danger, right? Or even maybe just perceived danger. Maybe we're not in real danger anymore. It's just perceived danger. What will happen is our body is primed to be alert and not be calm and relaxed, right? So imagine patients, if you have patients that are constantly stressed, maybe they're type A personality, maybe they got goals at work, maybe they got challenges at home or toxic relationship. Every time they secrete cortisol, it reduces their serotonin, right? So just remember that connection, because if we're not going to help them to manage their stress, they're going to keep on living with lower levels of serotonin, right? So that's really important. Of course, we're going to talk a little bit more about serotonin because it's a little bit more complex than that, but just to know that that's a part of what's happening in our body. And then stress activates the HPA, which produces cortisol. Stress also leads to mobilization and utilization of vitamins and minerals. So we use more vitamin C, E, and magnesium, potassium, and other micronutrients, B vitamins as well, when we are under stress. It also increases the metabolism of protein, fat, and carbohydrates. Fortunately, because it increases the amounts of sugar, high levels of cortisol were also found to be associated with higher weight. With patients that are struggling with weight loss, we have to make sure that they're not over-secreting cortisol all the time, because that will impair their sugar metabolism. There's an interesting study that found that there's an increased serum levels of malondialdehyde and cortisol are strongly associated with major depressive disorders. Malondialdehyde is one of the final products of polyunsaturated fatty acid peroxidation in the cells, and it is a marker of free radical. So how do we help those patients that have this stress response? They keep secreting cortisol over time, and then slowly it reduces. And so what we want to do is use herbs like ashwagandha, for example, was associated with reduction in reported stress. Ashwagandha is also supportive of adrenal function. Consumption of 300 milligrams per day of full spectrum ashwagandha root for 60 days reported to be safely and effectively leading to improved resistance towards stress, improved self-reported quality of life, and reduced level of cortisol. So what ashwagandha basically does, it helps to have a healthier stress response. If we have a stressful event in our life, we're still going to be stressed. We're still going to secrete cortisol, but it's going to be more mild, right? It's not going to be abusive. It's not going to be systematically abusive of our adrenals, which some patients, that's what they do. When you they're constantly living in panic attack. They're constantly going from one anxiety attack to the other. And with those patients, measuring their levels of adrenal function is really, really important, because their levels of cortisol throughout the day will show you, are they overproducing in some parts of the day and underproducing in others? So to give you guys an example, we had a patient that had significant anxiety attacks, and there were sometimes to the point in which she would get so anxious that she would start sweating, start having palpitation, and she would feel like the room is closing on her, right? Which is a terrible experience. It's almost like she's about to lose conscious, right? The two additional symptoms that made me think about adrenal dysregulation. One, she was very tired at some parts of the day. Like the afternoon was very tired. She almost felt like she just needed to take a nap. And the second one is that after every major panic attack, she felt like her energy was just collapsing, right? And she just needed to sit in order to not completely collapse. So those are the two things that made me think about maybe her cortisol levels is fluctuating. If cortisol drops, your sugar levels also drops, and that makes you feel very sleepy. So we did the test, and we did found that in the morning her cortisol was really, really high. In the afternoon, it was significantly low. And then in the evening, it was very high as well. And in the evening is where in the mornings, she would get those panic attacks. If any of you working with children that have attention disorder or anxiety, I want to share this data with you. The use of complementary and alternative medicine is quite wide in terms of helping those patients, those children. About 54% of parents reported using complementary and alternative medicine. And rhodiola is traditionally used as an adaptogenic. It's a herb that grows in extremely cold environments, and such as the Arctic regions of Canada, Europe, and former Soviet Union. And clinical studies have reported that rhodiola can improve cognitive functions such as attention, accuracy, and memory, has neuroprotective properties, and reported to prevent excess secretion of cortisol, balance the stress response, and reduce anxiety. There was a study with children between the ages of 12 to 18, and they started at 50 milligrams per day. So just a really small dosage. And every 7 days, they increased the dosage by 50 milligrams per day, up to a maximum of 500 milligrams per day. And it was well tolerated and beneficial for those patients, for those children. So if you're working with children that have attention disorders or anxiety, start in really small amounts, like 50 milligrams of rhodiola could be very beneficial. Especially with herbs, you always want to start with smaller dosages.